We'll now turn attention to the city of Mumbai, where it has become very difficult, not just for COVID patients, but for even non-COVID patients to find a hospital bed, to get a doctor, to get a consult. Is the city of Mumbai getting overwhelmed by the cases of COVID? Is the infrastructure creaking right now? Well, there has been a lot of political back and forth, and the government in Maharashtra has been under fire over this. In fact, the administration has come out today, including the Chief Secretary, to explain that the growth rate in Mumbai, or the doubling rate in Maharashtra, is come down to 14 days. So we should not really be worried. But anecdotally, on the ground, we are hearing day in and day out of patients really struggling to even just get a bed. Let's take a look at why this is happening. Speaking to me now on what exactly is going on in Maharashtra and Mumbai, and why there is this perception that we are running out of health infrastructure, I'm joined now by Dr. Ashutosh Raghuvanshi, the MD and CEO of Fortis Hospitals, and I'm also speaking with Dr. Hemant Thacker, who is of course a top physician at Breach Candy Hospital. Welcome to both of you, and thank you so much for speaking with us on the show. Dr. Raghuvanshi, I want to first get your sense on the situation, and here I also want to focus on non-COVID patients. This is what we have been getting anecdotally on the ground from a lot of people, that non-COVID patients right now, especially in Mumbai city, are struggling. They're struggling to meet their doctors, they're struggling to get a bed in the hospital, and some of them with very serious ailments. Has this situation deepened after the authorities decided to take over 80% of private beds as well?
I don't think that has impacted the situation in any way. I think because of the lockdown, I think there are a lot of inconveniences for patients, which is well documented. It is not anecdotal, but I don't think that has specifically made any difference. The difference is that the number of cases who require care for COVID in hospitals has been increasing, and a lot of beds are occupied doing that. There are a lot of healthcare workers who are not available, so that is again adding to a problem. The smaller centers which would provide care are not available as well. So these are multiple things which are all adding up to create a virtual shortage of services for non-COVID patients.
Let me talk about COVID patients as well, Dr. Raghuvanshi. Day in and day out, we hear of situations where, someone needs to be hospitalized, but there is a long wait for a bed anywhere, and then finally they manage to get a bed, but then there is a long wait for a doctor. What has been your experience, and what are you seeing on the ground? Is there truly a shortage of health infrastructure in Mumbai city?
See, this kind of epidemic always overwhelms the system, and I think that was the concern right from the beginning, and that was precisely the reason why a lockdown was instituted in first place. So definitely it is not only Mumbai, but many parts of the country are facing this kind of issues. And in Mumbai also, the infrastructure compared to the population and the needs is definitely falling short. But I think various measures have been taken, creation of some temporary facilities for less critical patients, and plus many private hospitals have also come forward. So it is there is an attempt to try and bridge that gap. And I think this is an unprecedented situation, and I think all of us have to understand that as the situation evolves, the strategies will have to be changed by the administration. And I think that is what they are trying to do. Of course, the private infrastructure is under a lot of stress, both because not being able to serve the non-COVID patients, as you have also noted, and at the same time, the COVID patients are also under price control, and that creates a struggle for the providers.
Doctor, I'll just share with you, and Dr. Hemant Thacker, I want you to come in on this as well. I'll just share with you about some of the stories that I have been hearing about, cancer patients unable to find an oncologist or do a biopsy if they need to, about long-term patients with, grave problems also not being able to contact their doctors or go out and meet them, about patients who need hospitalization for COVID-19 struggling the whole day to find a bed somewhere before finally getting one, and many of these have been well reported as well. Dr. Hemant Thacker, I just want to get your sense of the handling on the ground, and I know this has become a political issue now, which is why I've kept the politics out of it. You've noticed I'm speaking to two doctors right now, because what's important is to understand what's happening on the ground. It doesn't really matter at the end of the day which party is running which government. It's about people getting healthcare when they need. So Dr. Thacker, I want your assessment of the situation right now. How much of this is alarm and panic, and what is really happening on the ground?
I'm glad you've kept the politics out of it. We have to accept the reality. About 4 to 5 years ago, or maybe even a year earlier, we had the dengue epidemic, where people used to call and say, "Sir, I need to be hospitalized because my dengue is positive." So there was a dengue report in their hand and panic in their hearts, but no disease in the body. By the same token, what you are saying, that there is a clamor for hospital beds and no beds available, obviously the hospitals, private, public, all put together, do not have beds for the whole city. Nobody expects the whole city to fall sick. But the important message that ET now should convey is that not every or very few COVID positive patients need to be hospitalized. They need attention, they need advice, but they don't need to be hospitalized. I have patients coming to me every morning with the COVID positive report, say, "Sir, I want to be hospitalized." If you have facilities to isolate yourself, if you have facilities to check your saturation, then you don't need to keep asking for a bed. And then, of course, the television and the media says we had a tough time. We had to run from hospital to hospital, pillar to post, and finally get a bed. And when we got a bed, we did not get a doctor. Obviously, the doctors are there to serve the people who are admitted. If you don't need a bed because you are asymptomatic or mildly symptomatic, you shouldn't ask for it. And the government has correctly now said that partially symptomatic or people who can be supervised at home don't need to be hospitalized. It is because of this clamor that the non-COVID patients sometimes are suffering. As you said, the cancer patients, as you said, the chronic patients. Today, the municipality has made doctors leave everything else and go for COVID duty. But remember, the percentage of COVID patients is infinitely less than the percentage of non-COVID patients. So my duty is to non-COVID patients in as much as it is to COVID patients. And hospitals, because they are already short of nurses, a lot of whom have gone away, others who cannot come because they're in containment area, healthcare providers who are probably falling sick and cannot isolate themselves at home, they're all short of personnel. So we need to aptly admit patients only who need admission. Patients who come in have to be admitted in a COVID suspect ward, and we need to do their COVID test. Because if you take a non-COVID patient into the hospital...
Sir, I have a...
No, so what I meant is if you take every patient into the hospital
how do you
without
know?
a COVID test...
I think a lot of...
Go on,
yes.
Go on.
No, can I complete my question, sir? Because I think this is what viewers will want to know as well. You said very correctly that, if you have a COVID positive report, and it can happen to anybody, it doesn't mean that you immediately want to go into the hospital. But, the fear a lot of people have is that, how do I know? A lot of stories about this disease are, about very quick deterioration of health. You don't want to be in a situation where you're scrambling for medical help at a very late stage. How do you know who decides, who tells you, whether you need to stay at home, whether you need to be hospitalized, and then how will you be sure that you will get the medical aid you need when you actually do?
So if you have a family physician or an attending physician, or if you go to a quarantine facility where there are doctors, and if they say that your fever is not high, you're able to drink and eat, you're not breathless, and your saturation is good, it is probably cheaper to buy 1,000 rupees oxygen pulse oximeter saturation measurement machine and measure your saturation. If your fever is manageable, if your cough is manageable, if you're able to eat and drink, and if your saturation is good, all you need to do is be in daily touch with your physician or with the quarantine doctor, whoever is in the local facility. And you won't realize it will be 7 days and tally ho, you will be out of it. We have a lot of patients who come in, and after the second or third day, when by definition, if they have no fever for 3 days, if they need no oxygen for 3 days, we send them home. And they're surprised why we send them home. And then they ask for a negative report. You don't need a negative report. The health authorities are very clear. You had the corona, you don't need oxygen, you don't need hospitalization. Go home, quarantine yourself, look after yourself at home, and you'll be all right. It is for those people who cannot quarantine themselves at home that should not go to the hospital, but should go to the NSCA dome, should go to the Kandivali skyscraper, should go to public places where they are kept under observation till the numerical numbers of days are over to make them non-infective. Leave the hospital beds to patients either who have too many comorbidities or who need oxygen. Because the fraction of those patients needing oxygen, who have fluctuations in their heart, in their blood sugars, in their kidneys, those need hospitalizations. And that fraction is small. But if you're going to inundate and knock on the doors of the doctors and the hospitals for trivial matters like a positive report alone, without significant symptomatology, you're going to overwhelm the system. My colleague before me was very clear that no country in the world has as many hospital beds as citizens. The fraction is small. The pandemic is something which has come in for the first time. So we have to separate the grain from the chaff and the symptomatic from the non-symptomatic. For mental reasons, I cannot admit a patient. I need to admit a patient who is sick. And that's the dilemma. We are in the thick of it. We are probably where New York was in the third week of April. We are there now. We are wading through it. My patients are not dying. The mortality is not very high. I am happy to believe, and I'm hoping I'm right, that the virulence of the strain which has hit Bombay and our country is not so bad. Maybe we have good immunity. But that being said, the clamor for hospital beds is false.
Okay, that's a very important point. Dr. Raghuvanshi, I want you to come in on some of the points that, Dr. Thacker has pressed upon. Is there a clamor for hospital beds? And I want to revisit the, question I asked earlier. So 80% of all beds have been reserved by the state, for the treatment of COVID. Does that not automatically reduce the amenities and facilities available for those who may require hospitalization but do not have COVID? That is also a large number of people.
Tamanna, one thing you must understand in the order, it doesn't say that those 80% beds are going to be only for COVID. What it says is that the 80% beds are going to be under the public authorities' control. So there is a difference in designating all those beds only for COVID. What government is saying is that these 80% beds should be at a particular rate tariff chart which they have proposed, whether be COVID or non-COVID. So there is a little bit of difference, and that will make the beds available. However, there is a different matter here, which is about what kind of pricing is being suggested. So I think the healthcare industry is very aware that we have a social responsibility. So everybody has come forward, but I think there is an economic aspect of this whole thing, and that has to be also considered by the government. And I think we can only urge the government to consider doing something for the healthcare sector, because the most important vital part of our defense mechanism is the healthcare sector. And if that is not supported at this time and put under undue pressure, then there will be a problem. However, as far as the availability of beds is concerned for COVID as well as non-COVID, that is all included in that 80%. But you also must remember that the shortage of healthcare infrastructure in this country has been a matter of discussion for a long, long time. And especially the human resources. I think, as Dr. Thacker was pointing out, that many nurses have left. Already there was a shortage of nurses. On top of it, many of them probably require isolation. Some of them get scared, and some of them leave for personal reasons. And all that creates further shortages. So many beds which are there cannot be utilized optimally simply because of the absence of either nurses or doctors or other people. So the chronic shortage of healthcare infrastructure and human resources in this country has been a problem, and it is only getting exemplified because people are panicking, and a lot of them are wanting to get hospitalized when probably they could be treated in other settings as well, as Dr. Thacker was saying. So I think what is important to understand is that this situation is going to get controlled as the disease starts getting controlled. But for now, I think what government is trying to do, we are supportive of that. But at the same time, it does create serious operational challenges, and one of them, what you said, is that people have to sort of go clamoring and trying to find out where a bed is available. And sometimes if they are in critical stage, they may not be able to find it. So having this kind of control without telling how exactly the patient should go to the healthcare facilities, whether private or public, is creating confusion in people's mind. I think that needs to be clarified, and that will help a lot.
Yeah. No, that's a very important clarification, Dr. Raghuvanshi, because these 80% beds are now cornered, but you need a system, you need an efficient system to ensure that those who need it get to the beds. I asked Dr. Thacker a little while ago that, I'm sure there's no patient who is so eager to be hospitalized, but they just don't know. There needs to be someone or some authority who filters that, yes, you need a bed, you don't need a bed. And also another question, you talked about the economic angle as well. Beyond a point, can you really let a healthcare system be so tightly and controlled and managed by any kind of administration? Will it help or harm in a situation like this pandemic?
Healthcare should be controlled. We have absolutely no different views on that. However, when certain price controls, etc., are decided, they must be based on some science. There is a certain input cost which goes in providing healthcare, and I think as long as that is covered, as I said earlier, the healthcare providers are very much aware of their social responsibility, and I think all of us would step up and try to do our best. However, that economics has to be kept in mind. So just a price control without any scientific basis is going to be harmful. That is what our feeling is, and that's why we are requesting the authorities and government to become a little more data driven and go by the facts of what it costs to provide a proper optimal care. And that would be an ideal point for patients as well as for the providers. That way the healthcare infrastructure will remain alive. Otherwise, in this process, we would end up stressing up the smaller nursing homes and smaller hospitals which provide bulk of care. If in the current situation, they are not very comfortable on the economic level, and it can cause a lot of them to even shut doors. And that is not in anybody's benefit.
Absolutely. Well, let's hope the situation improves. We've focused the second big discussion on the situation in maximum city Mumbai. And got some great clarity from the doctors here. I think one important takeaway, if you are COVID positive, doesn't necessarily mean that you need to be hospitalized. That's something that the local authorities are trying to do. The Chief Secretary of Maharashtra has also come in and, fought back against all of the accusations of mismanagement, saying that the doubling rate is slowing down, etc. We'll hope that we come out on the other side of this with maybe some improvements in our health infrastructure. That long term would be a big positive. Thank you so much, Dr. Raghuvanshi and Dr. Thacker, for joining us on the discussion. We'll take a very short break on the show. On the other side, we have two fantastic interviews lined up for you. Sanjeev Bajaj speaks out on why it's important to lift the lockdown, and we have Neelkant Mishra of Credit Suisse talking about where he sees the economy going. Don't go away.